My name's Dr. Manrina Rhode. I'm an aesthetic dental surgeon and principal dentist here at DRMR Clinic. I've had my iTero scanner for about 2.5 months now. It's completely changed the way I work in so many different ways. I can't believe that I have been practicing dentistry for 20 years without it. We do all our whitening scans, so when patients come in, if they want whitening trays, we'll scan their mouth and click a few buttons. The scan is sent to the lab, nothing else needed, no collections from the lab, no filling out lab dockets. It's literally amazing, and same with our retainers. And obviously we use it for our Invisalign treatments as well. But separate from that, we also use it in new patient exams or just general recall exams. We scan every patient that comes in, and we get to show patients this 3D image of their mouth, which they absolutely love. They feel like we're using cutting edge technology, which of course we are, and it really allows us to educate our patients better on what's happening in their mouth. We can show them the outside, we can show them the inside of their mouth, parts of their mouth they've never seen before. Much easier to explain about their occlusion or the way they're biting together, and it's just a brilliant visual aid to keep our patients much better informed. Everything's changed about the way we work since getting our iTero scanner. Every patient that comes into clinic gets a scan, whether they're coming for a new patient exam, which then shows them how forward-thinking we are, how we're a digital clinic, how we're using the latest technology. So not only do they get that impression about us and realize how we're investing in them and providing the best treatments, but also we get to really clearly show them what's happening in their mouth and explain our treatment plan far more easily when we have a visual aid to show them what it is that we're trying to explain. But even recall exams, it's really useful to scan patients. And then, I've not had it long enough yet, but the plan is to scan them at their recall exam, and people who have issues either scan them 6 months later or a year later, so that we can superimpose the scans on top of each other and see if their recessions progressed, if their wears progressed, so we can keep an eye on any issues that they have and make sure that we're addressing them, and also show the patient how important it is for them to address them and do something about it, that it's a progressive issue. So as well as the recall exams and the new patient exams, we're also using it generally in our workflow for treatments. So patients who come in for an inlay prep or a crown prep, as long as the preps are super gingival, then we'll scan rather than taking conventional impressions. Also, obviously for whitening trays and retainers and our Invisalign cases, we're just scanning. So it's a much neater workflow. I like that it's so much more paper-free. There's less worrying about what time the lab is coming to collect and has it been collected and all of that. So it's really neatened up our processes and workflow using the scanner rather than taking impressions in a conventional way. So we want as many people in the clinic using the scanner as possible. We've been made aware that you have to be GDC registered to use the scanner. So at the moment I use it, obviously for my patients. My nurse is also trained in using it so that she can scan my patients while I'm writing notes or uploading photographs. Our treatment coordinator is trained in using it so that she can scan people when she's doing free initial consultations for them, or even pre-consultations coming in to see me. Our practice manager is trained in using it in case we need someone to step in and do a quick scan, but also our associate dentist and our orthodontist. So yeah, we're all using it. We have one scanner at the moment. I think we're going to have to buy another one soon. So our patient journey is super important to us. It's something that I lecture about and that I think is a fundamental part of every clinic. We've made big changes to our patient journey since getting the scanner, basically by adding that every patient gets a scan of their mouth as part of their appointment. So when a patient initially comes in, then at the moment, the way that we do it, our treatment coordinator will talk to the patient and then come and report to me. I'll bring the patient in, and then we're still early days with our scanner, so we've tried out 2 different ways of doing it. Either I will scan while I chart, so while the nurse is making notes, I'll just use the scanner to chart, and the patient also can be really impressed and see what I'm talking about as it appears on the screen. Or we've also tried another way of me charting in a conventional way, and then while I'm uploading photos, my nurse scans the patient. But we're also going to introduce the treatment coordinator scanning before the patient even comes into the room. So that's something to come. So we're still working on where exactly it's included in our patient journey, but every patient gets scanned, and we're trial and erroring different ways to see which works better for which patient. I guess one of my favorite things about scanning patients is I know what their reaction is going to be, and every single one of them is like, wow, wow. They don't really know what it is I'm about to do. When I say, oh, let's scan your mouth, I'm going to pop a camera in your mouth and take a 3D image so we can have a look at that. And they just kind of trust the process and say, go ahead. And I start scanning, and then maybe they'll start glancing over and seeing what I'm doing, and you kind of see their eyes open wider. And then once I've finished the arch, then we both look over together, and I spin it around and show them their mouth, and without fail, every single one of them is like, wow, that's amazing. What amazing technology is this new technology? And they want to talk about it, and I know that they're going to go home and tell their friends and family about it too. So yeah, it's been a really cool addition to our clinic, not only because it's really useful in patient education and being able to communicate with labs, but also just because of the wow factor. So I think the addition of my iTero scanner is one of the biggest changes I've made in the way I practice in the last 20 years. It's made a really big difference. So firstly, we scan every patient when they come in for a consultation, and we're able to give a visual aid to showcase the treatment that we're proposing. Also, this whole scanning, being able to email over the scan for whitening trays, means it's so much easier and quicker to get those made. We whiten most of our, I'd say 99% or 99.9% of our patients' teeth are whitened. So that's a big procedure for us. And actually, initially when I designed this clinic, I built it as a squat, and built my dream clinic. I allocated one room to be an on-site lab, specifically for whitening trays and retainers, because we do so much whitening and also so much clear aligner work. And now we've decided that we don't need that. With being able to scan the patient, email that over to the lab, and have it back within a couple of days, it's completely changed the way we work. And so now I'm thinking what else I can use that space for. Also, I remember at Christmas when my mind was completely blown. I had a patient who had just finished their clear aligner treatment and in retainers, and there wasn't space to put a bonded retainer on his upper arch, so he was really reliant upon his upper removable retainer. And he said that his child had put his retainer in the incinerator, and I think that's a whole new conversation about why his child was anywhere near an incinerator. But he emailed me and said, oh, my retainer's completely unusable, and I was panicked because I thought, his teeth are going to move. We'd only just finished his clear aligner treatment, but fortunately, I had scanned him at the end of his treatment, and so I knew that I had that scan. So I logged on to my iTero. I found the scan. I emailed it over to a lab. I asked them to make a new retainer and post it out to his home address. And within 3 days, over Christmas, he had his new retainer without me having to see him at all, which was pretty amazing. Another cool example was I saw one of my patients. I'd done their smile makeover, and she asked me to have a look at her son's teeth because she said he wasn't doing so well with his brushing. So I had this 19-year-old come in who doesn't brush his teeth twice a day, and he had areas visible interproximally on all his premolars and molars. So I took x-rays, and they weren't very visible, but you could just see that there was starting to be a little bit of decalcification there. But we have an AI technology that we use on our x-rays. So I put the bite wings through the AI and showed him how the AI was picking up on the cavities that he had, and then also because we had our scan, the iTero scanner has a really cool NIRI technology function. So I think it's near infrared imaging technology, NIRI. And what it does is you open up your scan and then you put magnifying glass, actually maybe that's a better word, on top of the tooth, and it's a camera that sees through the tooth, so it shows you if there are any interproximal areas. So using that, not only did this patient see the x-ray, see the AI technology, we actually used the magnifying glass to look inside his teeth, and I could show him where it cavitated, and hopefully really brought the message home about the damage that he was causing, and so we could make a plan about what to do about it, not only to fix the cavitation that he had created, but also moving forward to make sure this wasn't a long-term problem for him. So I think it's a really great learning tool, and it was cool to be able to use it in that way. So yeah, I'm really enjoying using my iTero. So I suppose the features that are most valuable to me are, it's really great for patient education to be able to show them what I'm talking about, as opposed to trying to explain. And maybe an x-ray can be quite confusing to try and explain what's happening there, but this is a view that patients can relate to more, kind of understand, oh, this is my tooth, and this is what you're seeing. So I think patient education is really valuable. I think the wow factor is really valuable. I think the patients love that we're using the latest technology. They can see that we really care about them, and so it's nice to be seen as that, because that's really who we are as a clinic. And also lab communication. I mean, that's just amazing how much quicker that is, how much quicker it makes the whole process. That's, I want to say life-changing, but like, yeah, practice-changing. Like, yeah, it's been amazing. So in answer to the question, what has maybe surprised me about the scanner, I want to say everything. I had no idea about scanning. I don't know how I got through 20 years of my career not knowing anything about scanning. I think it was because obviously the main treatment that I do is porcelain veneers, and I kept being told along the way that scanners weren't at a stage yet that they were suitable to be used for minimally invasive treatments like minimal prep veneers, and so it didn't seem relevant to my practice, even though a fair percentage of my patients will have clear aligner treatment before they have their porcelain veneers, so the treatment can be minimal. I still, because my focus was veneers, I don't think about investing in a scanner to help with that process. I freed up a whole room in my clinic because I was going to create a lab, and I don't feel like I need to do that anymore. Now I have a scanner, and I can communicate with my lab so quickly, send the scan over, and get my whitening trays and retainers back within a few days. So it's freed me up a whole room. So I think I had no idea how useful it could be as a tool until I started using it, and now I can't really imagine practicing without one. So obviously there's so much more to the iTero scanner than just scanning the mouth. It's also got all these cool features that you can play with. It's got a time-lapse feature, which I had no idea about until I learned recently, and was just blown away that I could provide that much value for my patients. So what you do is you scan your patient, and then you can scan them when they're back in 6 months or a year later, and then using the time-lapse feature, you can superimpose the images on top of each other, and you can see if your patient has had any more tooth wear, if they've got more recession. So yeah, that's a great educational tool for you, not only for you to be able to assess your patient, but also for you to make your patients aware of what's happening in their own mouth. I was also made aware of a really cool feature recently where you could do a pre-scan of the mouth before you restore, so that you could send that to the lab so they can create your new crown with the same occlusion as the mouth had previously that was working for the patient. Also, some dentists do a pre-scan, and then when they scan after they've prepped, for example, for a crown, then you can look at those two scans together and see how much space there is between in the occlusion. So put an upper scan, put a lower scan, a prepped lower scan, and then see if you've got enough occlusal clearance. And if you haven't, then you can create some more clearance and scan again, and make sure you never under prep your crowns again. And then also, obviously, the NIRI technology. So it's near infrared technology that the machine has, which I had no idea about, and it's really cool. using this magnifying glass feature, and you just kind of pop that on the tooth, and then it starts seeing through the tooth, and it picks up interproximal decalcification or decay for you. So that's a really cool feature that I had no idea about. So yeah, it's not just the scanning that people talk about that you can scan and communicate with your lab. There's so many cool features in my iTero, and actually there's more coming that I'm really excited about. Oh, the other feature that the iTero has that again I had no idea about was that you can do an immediate view of what teeth look like straight. So while you've got the patient in the chair, you don't have to wait for to send it off and get a ClinCheck back. It won't be as accurate as a ClinCheck, but you can click a few buttons and then it will show them what their mouth would look like straight. So even if they're not interested in Invisalign or mentioned it themselves, you can do that for them, and that opens that conversation. So that's really cool. And if you take a picture on your iPad, which we've started to do when in the patient journey, the patient speaks to my TCO and then has their photography with my nurse, and my nurse also takes a picture in the app on her iPad, and then when we do their straight teeth on the iTero, we can show them their straight teeth on their face. So it's not just teeth they're looking at, but actually how their face would look with straighter teeth, and all of that can be done within minutes while they're in the chair. So that's really cool. So for me, going digital is embracing the evolution of dentistry. It's so much easier to just stay where you are, doing the things that you know how to do well. And it's challenging and it's scary to move on and try and embrace technology and move forward. But you know what, we have to. And that's been a real theme of mine in this last year, embracing any technology that I respect and that I was made aware of, to try and evolve my clinic and make sure that we were using all of the latest up-to-date equipment and technology. So I think having been through that journey, having gone from doing things in a conventional way and having done things that way for a long time, I've been a dentist for 20 years and been taking conventional impressions in all that time, or reading x-rays with my bare eyes in all that time, and using a drill rather than a laser, and all these things. So I always say I brought all these new changes into my practice, moving forward and embracing the latest technology, and it's been challenging and it's been scary, but it's been exhilarating and it's been amazing. And it's just a matter of being courageous and going through that journey and having kind of come to the other side of it. So having embraced that and being a little way into it, it's amazing. It makes practice life so much more enjoyable. I feel like I'm working to the best of my ability. My patients can see that I'm providing the very best treatment for them, and yeah, it makes coming into work that little bit more exciting. So I was asked how I would feel if you took my iTero scanner away from me. The answer to that is I would not be happy. I don't want to go back to working the conventional way. I don't even like now, if for whatever reason I need to take a conventional impression, I'm like, oh, let's move the patient around and make sure the scanner's available because I want to scan the patient. I would not. I'm not going to be without this now.